This is a 13 News Now special presentation. 13 News Now presents Desperate for Dollars, the fight for medical research.
My name is Chloe Jarrett, and I'm 8 years old, and I like to dance.
Girls, do y'all remember which song this is?
It's the force field one.
Okay, here we go. The force field song.
Yeah.
I feel so close to you right now. It's a force field.
All right, now
I had not heard of type 1 diabetes. Wasn't sure what that even meant.
1, 2,
I was in complete shock.
3, 4. Good.
She was in the emergency room in Franklin, and CHKD sent an ambulance to Franklin to pick her up. By the time a meter could actually register her blood sugar, it was 596. She was in diabetic ketoacidosis.
And so was the beginning of a life-changing journey for young Chloe Jarrett and her family. She would join the 1.25 million Americans with type 1 diabetes, an autoimmune disease in which a person's pancreas just stops producing insulin. We all need insulin to regulate our blood sugar levels.
I have to check my blood sugar, give myself insulin, change my sets and my sensors.
A low blood sugar can be immediately medically dangerous for Chloe. It puts them at risk of a seizure. It puts them at risk of death if it's not addressed quick enough, and that's a constant fear.
Recently, fear turned to hope.
She was selected to participate in a medical trial at the University of Virginia to test an artificial pancreas that is under development. It was incredible.
So how does this work?
UVA's medical director for the Center for Diabetes Technology, Dr. Stacy Anderson, shows me how the artificial pancreas is not what you might think. It's not about transplanting a body part, but hooking up to real advanced technology. A continuous glucose monitor is worn on the skin.
It's a tiny little hair-like filament that's under the skin.
That's constantly measuring blood sugar and sending the information by Bluetooth to a cell phone app, which then speaks to the insulin pump.
If you're managing your blood sugar and you're between 70 and 180 during the day, algorithms don't need to intervene. You're doing well on your own. But if it sees that you're going to go out of that range, either on the high side or the low side, then it can start supplementing the insulin that you have already given.
What do you even start with when you try to come up with something that sophisticated?
Well, we started very long time ago.
More than 20 years ago for Dr. Boris Kovachev, the primary mathematical mind behind the algorithms that make an artificial pancreas possible. It started with creating the mathematical models to quantify diabetes, figuring out how the human metabolic system works in diabetes. By 2005, they were on to something.
Diabetes may be controllable automatically.
Animal trials began until Dr. Kovachev created a computer simulator to replace the animal trials in 2008, which then led to actual human trials that same year.
We needed a portable device with significant computing power, and the logical host for that kind of device with significant computing power was a smartphone.
And by early 2012, Charlottesville became the first city in the U.S. where patients walked the streets testing the portable artificial pancreas. And since then, the trials have gotten even more sophisticated.
I'm so juicy. And the device made my blood sugar stay in the 90s and the 100s.
Something that our current insulin pump can't quite do, even with the continuous glucose monitor she attaches to her arm.
You know, the high blood sugars are equally as scary. They can lead to long-term health issues that are difficult to deal with that can impact her kidneys, her liver, her eyesight.
There you go.
So you battle that fear over a low and a fear over a high blood sugar, and so a device like the artificial pancreas that would limit the amount of times that you experience those very scary blood sugars is something that I can't wait to get my hands on.
The development of UVA's artificial pancreas is supported in part by the JDRF Artificial Pancreas Project. JDRF, Juvenile Diabetes Research Foundation, an organization whose aggressive drive for research is down to a science. Consider their Children's Congress tapping on the experiences of 150 kids living with type 1, including my own son, Trevor, who took it upon himself to get involved in the push for research to find a cure.
I was diagnosed at age 8, and now I am 11.
It's a fast-paced 3 days in the nation's capital, sharing similar stories, hearing from experts, and soaking up advice from celebrities who all battle type 1.
Have a great day today.
Children's Congress delegates and parents fill buses headed for Capitol Hill. It's time to come face to face with the decision makers.
Hi there.
The 4 members of the Virginia delegation are ready.
99.9% good.
And a hearing before the Senate Committee on Aging begins.
I'm delighted to convene this biennial hearing in conjunction with the JDRF 2017 Children's Congress.
Sprinkled through the testimony, examples of the medical miracles research can bring.
Then at 14, I got a continuous glucose monitor, or CGM, and an insulin pump. It made my life so much easier. Now all I have to do is look at my phone, which kids my age do anyways, and I can see my blood sugar. It has been life-changing.
But steps away from a cure from the disease that killed this delegate's father.
And he died less than a year after my own T1D diagnosis at just 38 years old. I am here today asking you for more support and more funding for more research because no one should have to suffer and lose their life because of T1D. I am here inspired by his memory,
emotion,
and determined that none of the kids here are sitting in a hospital room. I'm sorry.
Cannot escape the plea for help and the pitch for the renewal of the $150 million special diabetes program that expires in the fall. So many of the advances in type 1 care can be attributed to that program, including the artificial pancreas.
Jonathan is on the latest and the most advanced technology, and he is doing everything right. But the ugly reality of diabetes is that as hard as we work, our kids are still vulnerable. This past June at Jonathan's eye exam, it was discovered, sorry, I'm gonna get it together, that Jonathan has 3 dot hemorrhages. Children with type 1 diabetes at the age of 14 should not be diagnosed with diabetes complications.
JDRF leaders say not renewing the special diabetes program would be devastating, possibly stopping clinical trials that chase progress dead in their tracks.
These trials will bring us closer to the goal of having multiple artificial pancreas devices that are FDA approved.
The hearing is not enough. Children's Congress delegates fan out across Capitol Hill. They will each personally ask their representatives for support for research funding.
Hello.
Hi.
How are you?
Good.
Nice to meet you.
Nice to meet you too.
Kira Realmuto is from Roanoke, so she meets with Congressman Bob Goodlatte.
I'm here to ask you to continue to fund the special diabetes program.
Great. Well, we'll definitely be supportive of that.
We need to tell our stories.
Yep, we're going to tell our stories with the scrapbook pages.
I'm going first.
You're going first?
Michael, Joshua, Trevor, and Kira iron out their strategy before their big meeting.
We have a 1:30 appointment with Senator Kane.
Okay, perfect.
My name is Michael.
Hey, Michael.
From Great Falls.
Okay, fantastic.
We brought our scrapbooks.
Great. Let's see.
And for the next 30 minutes, Senator Tim Kaine hears the stories about living with type 1.
This is me when I was diagnosed at 11 months old.
4 different, yet so similar accounts.
This is all my first year of insulin shots, and that's a banana.
Oh my gosh.
That's the size of the pile.
Oh my gosh. That's a very good picture. That really helps you see.
This is what I prick my finger for
Mhm.
when I put the blood into these little, if you can see,
Mhm.
there's
Yeah.
little spikes coming off.
My blood sugar was well over 800, and so I just stayed at the CHKD, had a great time.
Isn't that a great hospital?
Yes.
Really nice people there.
They had lots of game rooms and stuff.
We've also done the bike rides for JDRF. So all in all, after this year, my family will have raised about $250,000 for JDRF and diabetes research.
That's amazing.
This was when I was 24. This when I was 31.
31 what?
Years.
30. No.
His blood sugar.
My
Oh, okay.
blood sugar was 31.
We've all done our parts raising our money, and we'd like for the House and Senate to do their part.
And this is just my hope. And my hope is pretty much that one day there'll be a cure and people will support JDRF and the SDP. And we'll one day find a cure and make devices.
That's great. What a great book.
Coming up, meet the superheroes being created by a giant in biomedical research. Just how are scientists working to kick cancer? Then, picking up the beat for lupus awareness.
I just have a strong intuition. I may be the one that comes up or may find a cure. You don't know. How do you find the drugs that treat us?
One patient's determination to find the clinical trial that leads to the medical miracle she's been hoping for.
I don't really care what kind of chair I have.
Brody Henderson is 11 years old.
I hope they can cure me so I don't have childhood cancer anymore.
He battles a brain tumor for the second time, the first when he was only a baby.
I had a feeling. I had a feeling in clinic. I always have a gut feeling when there's something wrong. I just knew that it was bad news, but I couldn't show it. I had to be strong for Brody, and I had to be strong for my family.
When Brody is not getting chemotherapy at CHKD,
My mom and dad say I'm a fish.
he's doing what any preteen boy would do.
He's a great kid.
He applied and was denied for one clinical trial testing treatment for astrocytoma.
If a trial comes up again and he has the opportunity to join it, then we would love to do that. It's very important. It's important for the trials, and it's important for people to help with those trials and help those trials go on.
we are the place where those first-in-human kinds of research trials are conducted.
The National Institutes of Health Clinical Center in Bethesda, Maryland. It's the largest hospital in the country devoted entirely to clinical research.
How would you describe just the quantity of trials that are out there?
So today there are between 1,500 and 1,600 active trials here at the clinical center.
Many of us believe that cancer is something that occurs in all of us quite frequently, but we're very fortunate to have this immune system that protects us.
And Dr. Richard Childs in the lab of transplantation immunotherapy says that fact serves as a perfect launching point for research, focusing on those immune cells, natural killer cells as they're called, and turning them into superheroes.
The immune system can surveil this cancer, and when it sees a cell that's behaving irregularly, that's become cancerous, it can kill it at its very early stages. And our laboratory has been trying to study why can these cells that initially kill cancer cells so effectively, why once the cancer becomes established, are they less effective in doing that? We have spent a lot of time coming up with ways to potentiate these cells, enhance their ability to kill.
By taking them out of the body and genetically manipulating them before injecting them back in.
So all those little dots?
Yeah, each one of those little dots is a T cell.
The T-cell harvest at Dr. Christian Hendrick's lab can produce an even stronger superhero.
Our main area of interest is these human papillomavirus-induced cancers.
Your T-cells may have a more destructive punch against a cancerous tumor.
Where we would do surgery and operate and remove one of the widespread tumors from patients with cervical cancer.
Okay.
And then we would grow the T cells that were attacking the tumor out of the tumor, grow them up into huge numbers and give them back to the patients. And we had 2 patients whose cancers went away completely.
It's immunotherapy that's working.
Cancer research money is hope, and it's hope for those patients and families.
And makes a CHKD child cancer doctor extremely excited. Today, the hospital celebrates a much appreciated $50,000 donation for research from Hyundai. A drop in the bucket compared to what comes from the federal budget. But the National Institutes of Health right now is the target of a $5.8 billion cut in President Trump's proposed budget.
The umpteen billion dollars that they get, and they say, oh, we're going to make, that sounds like a lot, we're just going to cut it by 15%. Well, it trickles down.
To the clinical trials that happen right here and all over the country.
We're following all kinds of clinical trials. And the thing people know, there are hundreds and hundreds and hundreds and hundreds of clinical trials. A lot of them don't pan out. That's okay.
You have your good days and you have your bad days.
If there is something that could make living with lupus just a little easier, Karshina Jackson wants to know what it is.
And all I usually do is just sit there and wait for a bite and hopefully want a bite. Some people that do know about lupus, they know. They'll check on you more. They know the stink of lupus. They know that's a critical illness.
Peaceful Friday night fishing is such a contrast to the attack going on in her body right now. Lupus is causing Jackson's immune system to do battle with her organs and tissues. There is no cure.
This year has been my worst year. I've been doing very well with it.
Jackson, a Medicare team coordinator for Centera,
and we make sure that we get the right payment on these claims.
Was temporarily in one research study sponsored by drug giant Pfizer that didn't work out. So she's waiting on word on another study she hopes will test a drug that can help contain the way the disease ravages her skin.
Because some medicine may not be good to you because like the medicine try to say, I can't take it. because it gives me hives. So they stop me on that drug, and then I have to go to another drug. If that drug is not good for me, they'll put me on another drug. So it's technically, the drugs that they give you is the same thing. You got to think about it. All of it's a trial.
How much CellCept are you taking?
Was 1,000, but it's now 1,500. I just upped it, yeah.
Yeah, that's a good dose, so that's the maximum dose.
Jackson takes 14 different drugs every day.
Anyone could get lupus.
So lupus advocates are getting into the rhythm of holding more awareness events like this Zumba party in Hampton.
Lupus is one of those mysterious illnesses that a lot of people don't know about, and so they tend to kind of just not support it.
According to the Lupus Foundation, the disease has a history of disappointing results from clinical drug trials. And just like the young kids with type 1 diabetes, lupus patients are waiting for congressional approval of millions of dollars in research funds.
Bo, bring me the towel, baby. My first fish. Doing this trial, it can't do no but better us. That's what I feel. A lot of people don't want me to do it, but I just have a strong intuition. I may be the one that comes up or may find a cure. You don't know. Because how do you find the drugs to treat us? They don't have a specific drug. They just have the cancer drugs or random drugs to treat us right now. Yes, we need something. I'm determined. I'm not going to stop.
Still to come.
And his father died of Alzheimer's. And we don't want our daughter to die of Alzheimer's.
So hand in hand, this couple steps into the world of Alzheimer's research, what one study shows, and the hope to participate in another one.
Don't worry about that. All right, let's. It's kind of exciting to help mankind to be in a trial.
Nice little breeze going.
Yeah,
sun shining.
Walter Mooney has Alzheimer's disease. And on this beautiful day, he takes a stroll with his wife, Marla.
Listen to her, she's the boss.
He may be losing a grip on his memory, but he's holding on to a sense of humor.
Well, we care for each other, and love each other, and put up with each other.
Right. And holding on to hope that new therapies being researched will make a difference, not just for him.
And his father died of Alzheimer's. So, yeah. And we don't want our daughter to die of Alzheimer's.
So this is actually him.
To most people, this image of Mooney's brain means nothing. But to EVMS Dr. Hamid Okravi, the director of the Memory Consultation Clinic, it tells a story.
This right here is a little bit more defined.
Right, exactly.
And then when you get a period, it's kind of a little bumpy a little bit.
Exactly.
It's what's called an amyloid image. And Dr. Okravi shows me how it indicates the presence of Alzheimer's disease.
As you see here, we can't really differentiate between the cortex and the white matter.
Mooney's image was taken as part of a 4-year, $100 million study called IDEAS to demonstrate amyloid imaging's value in actually diagnosing Alzheimer's. One image leads to one very important conversation.
As I discussed the result of the amyloid imaging, it kind of confirms our previous diagnosis that the cause for memory problem is most probably Alzheimer's.
Having an image makes a patient more attractive to a government trial. Mooney waits for word on one.
It's in the 3rd phase now, and it's actually causing the Alzheimer's patients to do better on cognitive tests, which to my knowledge is the first time there's been any reversal. So it's extremely exciting.
Good job. The easy part was done. We're working on the hardest part right now.
Right now, they can only hope he gets in.
And they're having a big ring ding at the barn dance.
Signing up doesn't automatically mean acceptance. All the pieces have to fit. Are you just the right candidate for the trial?
It was a lot more fun when it first started.
In the meantime, Dr. Okravi uses the IDEAS study to create more effective treatment plans. Once insurance companies see better care, hopefully they'll cover the up to $10,000 cost of the image.
I have changed my management towards patients based on the knowledge of this study much more than 65 or 68%. I really can't tell you exactly, but I think probably it's close to 80-85%.
We've been through quite a year, haven't we?
Yeah.
Alzheimer's is so sad and so devastating, and sometimes I feel like because it's usually seniors involved that it doesn't get the attention that some other diseases do. And for people that have gone through Alzheimer's, we want the attention.
There are tens of thousands of clinical trials going on right now across the U.S., and research advocates say they're fighting for funding streams, both public and private, to continue to flow to take these studies to successful conclusions. Research is at the heart of medical advances being reached almost every day. If you would like to learn more about the research at EVMS, NIH, or UVA, log on to 13newsnow.com. I'm Janet Roach. Thanks for watching.